Clinical manifestations of psychological stress in the oral cavity. Stress is the body's psychophysiological reactions to various emotional or physical stimuli that interfere with homeostasis and can exacerbate disease resulting from bacterial and viral infections in animals and humans. Research shows that stress contributes 50 to 70% of the incidence of the most disease, including the oral cavity. Various manifestations of psychological stress in the oral cavity include temporomandibular joint disorder, recurrent ophthalmopathitis, oral lichen planus, and burning mouth syndrome. Severe stress can cause changes in the body that is basically preparing the muscles of the body, including the temporomandibular muscles, to deal with any form of threat and burden that is beyond normal. Changes in these muscles are in the form of increased muscle activity or hyperactivity. The state of hyperactivity, long-standing or continue constantly, triggers muscle fatigue, which will be followed by the occurrence of muscle spasm. Muscle spasm will trigger a change in the pattern of mastication, relationship disharmony tooth, upper and lower jaw, the imbalance of load distributions, and if it lasts a long time or continue constantly will cause interference, even further damage to the temporomandibular joint and or the surrounding area. In patients with recurrent ophthalmopathitis, stress response resulting in the hypothalamus secretes corticotropin-releasing hormone or CRH. This hormone then stimulates the pituitary gland, release adrenocorticotropin hormone or ACTH. This hormone stimulates the adrenal cortex to produce cortisol. Glucocorticoids, including cortisol, suppress immune functions such as immunoglobulin A, immunoglobulin G, and neutrophil functions, so that microorganisms are easy to invade mucous, and microorganisms are also difficult in phagocyte, causing easy infections. This is similar to oral lichen planus, where the duration and severity of oral lichen planus are related to patient conditions and history of stress. Prolonged stress conditions cause adrenal fatigue, which result in dysregulations of the HPA axis, and decreased cortisol levels lead to increased production of pro-inflammatory cytokines, as well as excessive activation of the immune system and inflammation causing autoimmune disease. In patients with burning mouth syndrome are known to increase cortisol. Excessive release of cortisol will cause hypocorticolism in the body. Cortisol acts on nerve tissues regeneration and protections. High or low cortisol levels can damage nerve tissue. One of which steroid hormones cortisol, which stimulates changes that cause symptoms of neuropathy burning mouth syndrome. The interaction between salivary efferents, gustatory, and somatic efferents occurs in burning mouth syndromes. Degeneration of primary gustatory efferent nerve fibers and loss of control of inhibition of oral somatic efferents are the causes of the burning sensations.